I feel myself as the luckiest person because I got this opportunity. Surgical technologists, they have a lot of questions all the time. I thought, why not just make a video of it?
I think it's good that you're talking to me about it because
What is the very first thing that clicks in your mind when you hear about the scrub tech? So what do you think, like, scrub techs need to be more careful and more prepared in favor of the patient's best care?
preparation, I think, is key to.
Like in hierarchy level, scrub techs are at the lowest level.
Depends who you ask, I guess.
Looking in that aspect, what do you think, like, how they should be treated?
You guys have a different knowledge base than us. You guys got to be organized. If you're an unorganized scrub tech, you're going to have a bad day.
Whatever the mentality you come with,
Thinking about what you're going to do next, and then all of a sudden the tech you're working with hands you something, and you're like, that's what I needed.
yeah, and by looking in the X-ray, I can tell like what size of screw you're going to be needing.
Yeah.
Other very important question, because some new scrub tech who have not worked with you, you are doing a case which is like a complex case, and you are given a scrub tech who does not do those kind of cases. Are you okay with that?
But to say that I'm not okay with a certain person coming into the room, of course, that doesn't mean that to discourage people from where the nervousness and the stress comes in.
I have a very surprise question at the end.
Surprise question from Yusuf.
Who is your best scrub tech? This is your last day, and
The last day.
and
It's sad.
I was
sad.
I mean, everyone will definitely miss your hair.
Yeah, I'll miss it too.
Hello everyone, welcome back to Surgical Tech Show, and this is one video that is coming after so long because I was really busy and this is not so easy to make the videos very often. And today is a very happy day and very important day. I have a very special guest with me, and I had this opportunity to start working with him the very first day of his fellowship and until the very last day of his fellowship. I feel myself as the luckiest person because I got this opportunity to work with him the whole entire time, and I will have some very critical questions, and I really want him to talk about surgical techs who are in the field or not in the field, or they want to join this field. There will be a lot of information for them as well. So with me, special guest is Dr. Nicholas Frane.
Thank you, Yusuf.
First of all, thank you very much for joining, and this is so much pleasure, and I had really great time working with you the whole time, and it was awesome time that we spent together.
It was.
And congratulations to you on completing your fellowship today, which is the last day.
It is my last day, so thank you. It's been a pleasure, and I've learned a lot from you guys as well.
And there's a lot of people and a lot of surgical technologists, like they have a lot of questions all the time.
Yeah.
So I thought, why not just make a video of it?
Sure.
So they get some ideas from you as a fellow, and obviously, I mean, the fellows are just like a surgeon, so they can answer the best, like what the surgical tech's job is, how they can improve, and how they can be helpful for you, how they can helpful for themselves as well to make the job easy for themselves and for you and for the best patient care as well.
Yeah, and we're kind of in a position where we're learning how to graduate from residency, become fellows, and then transition into being an attending. So we're in the process of learning how to communicate with everyone in the room, including the techs also. So it's a learning process for us as well. So we've interacted enough and kind of figured that out. But so I think it's good that you're talking to me about it because I'm in the process, and I've been in the process over the year of figuring out the ins and outs of working with the scrub techs as a more graduated level. So
yeah, and let's start a little bit questions so the other people can listen and get some ideas as well. So that will be definitely helpful for all the scrub techs.
Yeah, that'd be great.
So what is the very first thing that clicks in your mind when you hear about the scrub tech?
About the scrub tech or just about scrub techs in general?
In general.
First thing that comes to mind, when I've been in training and learning, I've focused with the scrub techs because I've learned a lot from them. They know where to find certain drills and screws, so I've
instruments as well,
looked up to them a lot because I've learned a ton from them for that. And if you know where everything is also, then it makes it for a lot more efficient. But I think of scrub techs as basically another member of the team, and without them, you cannot get the surgery done and get patients better with whatever the goal is. So I think of scrub techs in general as a very critical part of the surgical procedure, and the efficiency, as well as the how well things go.
And they complete the surgical team as well.
Yeah, yeah.
My second question to you is, orthopedic trauma is very critical cases.
Mhm.
So what do you think, like, the scrub techs need to be more careful and more prepared, uh, I mean, in favor of the patient's best care?
Yeah, so high level, complex cases, whatever field you're in, whether it's orthopedics or general or any of them, kind of require everyone to be on the ball, and to be able to kind of think on their toes and work with each other and kind of predict what each other are thinking. So I think part of that only comes with working with people long enough, and part of it comes with preparation on everyone's part. You guys obviously have to prepare quite a bit depending on what the case is. Preparation, I think, is key to everyone having the same goal and succeeding. And you guys' preparation is a little bit different than ours, but what kind of brings it all together is us communicating, so you guys know exactly what we're doing, you guys and girls know exactly what we're doing, what the idea is for the procedure or what we have planned, so that you can kind of think like we're thinking, so we're on the same page and kind of working in sync rather than kind of trying to catch up.
Yeah, yeah. And as you probably know, like in hierarchy level, scrub techs are at the lowest level.
Depends who you ask, I guess.
This is not about like that people like think about, but the thing is, like, obviously everywhere they have levels. Like, I mean, who sits where?
Mm-hmm.
Like the CEOs, and then other people, and then the other people. So same way, I mean, the OR has its own hierarchy level.
Sure.
So as a hierarchy level, I mean, as a scrub tech, we work so hard, like opening heavy trays, assembling them, working at the same time, focusing on the surgeon, fellows, students, residents, nurses at the same time. So there's a lot of input that we get at,
Yeah.
I mean, the whole time. It's a lot of input. It depends, like, how many people, I mean, how complex the cases are. There's a lot of things that, I mean, a lot of factors in there. But again, like, looking in that aspect, like how hard we work and all those kind of things, and being at the lowest level in the hierarchy, what do you think, like, how they should be treated, just in your own point of view?
Well, everyone should obviously be treated with respect, but I think of the scrub techs not like that hierarchy at all, because I've worked with scrub techs that can make or break how things are going. I mean, some of the scrub techs we work with here, Yusuf and some of his colleagues, they know so much about it that, you know, they're working with you alongside you as a teammate, not like you're working for
Yeah.
me. And so that's why I don't see the hierarchy thing as black and white, because I know that without a scrub tech that knows what they're doing, doesn't matter who you are or what you are, surgeon, it's going to be very difficult.
Yeah.
You can't do all jobs at once, and there's a lot of stuff that you guys know that we don't know, and there's stuff that we know that you don't know. So I have a lot of respect for the scrub techs, and I've worked with really good scrub techs, and you can see the impact they have on how much easier or harder things are, and being able to think ahead and basically make things flow better, and even contributing you know ideas when we're stuck, or if we're having issues with certain implants. And a lot of times the scrub techs will have an idea of something because they're thinking about it differently than we think about it. You guys have a different knowledge base than us, so
And the other thing is, like, I mean, since you are doing the surgery and you are busy into the patient, and we get a little bit more time to look, like, the right number of the implants and right number on the screws and those kind of things.
sure.
That, I mean, we feel like that makes your job easy that way. So we have everything, and making focusing a lot more and paying more attention when we are giving something to you,
Yeah.
making sure this is a correct instrument, correct screw, or correct implant.
Yeah, and you guys got to be organized. Like
Everything lined
if
up.
you're an unorganized scrub tech, you're gonna have a bad day.
It happens sometimes.
Yeah.
When the case just pops and in emergent, or sometimes we are flip flopping the cases all of a sudden, because I know like my next case is lined up.
Yeah.
Everything is good to go, but all of a sudden case clicks and we are just getting a new trauma.
Right. Now, let me ask you a question. It's kind of on the same topic. So, sometimes there's cases that you set up, and then you're in that case, and so you set your own stuff up. You know what's going on. As you know, there's different people that give you breaks, and you may be out at lunch or breakfast or something, and then someone else might have to set up your case. You know is going to be particularly difficult because we all communicate, so you have a pretty good idea of if a case is going to be straightforward or if it's going to be complex and what to expect. So how do you deal with walking into a case that you already knew was going to be complex and maybe you didn't get to set it up? Someone set it up who maybe doesn't do orthopedics or trauma and different than how you do things.
It happens actually. It happens a lot, because the thing is like we cannot I mean, pick and choose like what time I want to go and stuff like that is
Yeah.
really, really hard. So the thing is like if I come back before the case starts, I just scrub in right away in the case.
Mm-hmm.
Before even the patient is in the room,
Mm-hmm.
sometime patient is already in. Obviously, I have no choice. But if I have a choice, I just come and organize the stuff that the way I want it.
Yeah.
Whatever the mentality you come with, that is something that you can change with your own brain, own thinking. That's what I do. I just try to make it like, okay, because I know preferences sometimes. Even if I don't know the preferences, sometimes I just know the sequence of the cases.
Yeah.
Like what needs to be done, what is going to be the next, what is going to be the next, because the concept of this case is same.
Mm-hmm.
I mean, if I'm doing a total knee, they need implant, they need to do the cuts, they need to do those kind of things.
And I can't tell you the number of times where I've been doing something and so focused on one thing, and you're thinking about what you're going to do next, and then all of a sudden the tech you're working with hands you something, and you're like, that's what I needed.
Yeah.
But you weren't thinking about it. I was like, you're thinking about putting a screw in or something, but you can't see well. And then all of a sudden, someone's handing you a retractor so that you can see well. It's like they knew you couldn't see well before I knew I couldn't see well.
Exactly. Even sometime if we just do the cases like you do the same cases all the time, like a distal radius, I know. I mean, by looking in the X-ray, I can tell like what size of screw you're gonna be needing.
Yeah.
And sometimes you don't even tell us like you need a locking or non-locking, because I can tell like this place cannot go with locking.
Which just goes to show how much you learn by working with us, because that takes all of residency to figure a lot of that stuff out.
Yeah, and there's another very important question. It's a kind of like very confusing to the new scrub techs as well, and everyone really, really likes to know. Because some new scrub tech who have not worked with you, and they very rarely do even orthopedic cases as well, especially the trauma cases.
Mm-hmm.
And all of a sudden, when they come and see you at the very first time, they get nervous. Our focus is patient. If you get nervous, you probably cannot perform well. It happens to me. I don't know about others.
Oh, yeah.
But the thing is, like, what you think to make them not nervous, cool, calm, and make their, I mean, room good for them, so they're not nervous. If they're not nervous, they can perform better. What do you think, like, what would be the best practice to make them feel not be nervous?
Well, it's different for everyone, right? Like different people communicate differently, different people respond to different types of communication differently, but I think it comes down to introducing yourself, asking what we're doing, get an idea of the surgery, show interest. I mean, anytime someone's gonna show interest in what you're doing, I would imagine that most people would be willing to sit and talk to you for a few minutes, explain it to you, give you an idea of what we're doing, why we're doing it. I think that will just kind of open the door for that line of communication, and then that will ease the tension, something like that. Now, different people get nervous in different scenarios. Some people are more quiet, some are more outgoing, but surely if you're willing to talk to someone about what the plan is and how they can best be of help, I can't imagine anyone would not be receptive to that. Yeah, when I'm in those situations, I don't know who people are. I just go up and introduce myself as myself and see what they say back.
Yeah. And communication makes it easy, like the way they respond to you, and the way they are talking, and that gives you like idea like how you can communicate during the case as well. I think that's what I do. But I just wanted to know your point of view about that. And there's another question that, I mean, we always discuss in between us. Like between us mean like between our scrub tech fellows.
Yeah.
So we always thinking like, I mean, that person does not do any orthopedic, that person does not do any orthopedic cases, especially the trauma cases, when like complex cases and special cases. If you are doing a case which is like a complex case, or polytraumas, multiple limbs, multiple vendors in the room available, multiple system that you are dealing with, and you are given a scrub tech who does not do those kind of cases, are you okay with that?
Well, I think it kind of depends on the scenario and what you're dealing with, right? If something's going emergently in the middle of the night, you're and you have to do it, you're going to do it. But I think the way things.
I mean, I'm not asking about any IND cases. I'm talking about.
Yeah. I think the more realistic scenario now is most of the big complex cases we can save for the day, so that we're with a team who does that, because I think that's
Yeah.
the safest option for patients.
Yeah.
If it's not an emergency that needs to go, say, in the middle of the night, and I think that's important to just think about, because that means that what you're doing is making it safer for the patient, right?
Yeah.
Like, I would wait to do a case in the morning with you or one of the orthopedic techs who has been trained and I've worked with, instead of doing it at night.
Yeah.
So that just gives accolades to how important you guys are in the process, right?
Yeah. Yeah.
You know, we're not going to do something on a weekend or in the middle of the night that we think we could do a better job of and a safer job of during the day, or on a weekday where we have the full team.
Yeah.
Now, but to say that I'm not okay with a certain person coming into the room, of course, you know, you work with everyone. Someone's got to start somewhere. You didn't know orthopedics at some point. But luckily, they have systems in place where when someone's being introduced to something, they're not alone, right? You guys train people half the time. There's someone new,
Yeah.
but you're training them so that they're not thrown to the wolves and in a polytrauma case, and you know they don't know what's going on and they don't understand any of the instruments.
Yeah. Yeah.
At the end of the day, we're all responsible when we're on a team like that. But it does make a difference when someone, you know, has been trained in something, and that doesn't mean that to discourage people from doing any specialty as a scrub tech or what have you, but it obviously took a while to learn to do what you do.
Yeah.
So there's a safe way to learn that, and that's with someone teaching you, not, you know, necessarily having to do it on your own. And that's where the nervousness and the stress comes in, is when someone gets put in a scenario like that where they are probably not doing something they normally do, and it's a high intensity situation. And
Yeah. Well, thank you very much for your opinion on so many things and so many questions that I had, because these are the questions that we talk about each other, and I had these questions, but I have a very surprise question at the end.
Surprise question from Yusuf.
My question is, in your life, who is your best scrub tech?
It's gotta be Yusuf, right?
Well, I was gonna say.
No, they're
like,
all, honestly,
you
you
don't
guys
have
are all
to say
wonderful.
me. I was just kind of curious. Like, you probably have seen like so many.
I have. And everywhere you go, there's a lot of good scrub techs that are really well trained in different things. And, you know, the core group of scrub techs here are really, really well trained in orthopedic trauma. You guys know as much as anyone in the room about the cases. You know, you basically know all the steps to the procedure.
Yeah.
Same as us.
Yeah.
Right?
Yeah.
Because if you didn't, then you wouldn't know what to do next. And you guys are got to be 2 steps ahead, because that's how things keep going well.
But it's definitely a great opportunity to talk to you, and this is your last day, and I was
My last day.
for the fellowship,
It's
and
sad,
I was
sad.
I mean, everyone will definitely miss your hair.
Yeah, I'll miss it too.
And this is definitely a part of a great memories.
Yeah.
And best of luck to your new journey and new place.
Yeah. Thanks for everything you've taught me.
Yeah.
Hope I've taught you something also.
It was amazing time.
Yeah.
But thank you very much again.